Unfortunately, our medical education is a little warped. We medical doctors, we focus only on the profession.
Yes.
We manage our finances very badly. We don't know much about the rest of the world. And that is a weakness. So dealing with doctors, sometimes you have to educate them. Like climate change is an example. I go to the leading doctors and they don't know what it is. Then we have to educate them.
Welcome to the Luminary Lounge. I'm your host, Dr. Aruna Muralidhar, and today we have with us an extraordinary leader whose influence has touched almost every corner of Indian healthcare. Dr. Alexander Thomas is a surgeon by training, but his true legacy lies in the way he has shaped healthcare policy, hospital leadership, medical education, and the welfare of healthcare professionals like me. Over more than 4 decades, he's not only treated patients but also transformed systems. Among his many achievements are securing equivalence between MDMS and NBE qualifications, ensuring the autonomy of the National Board of Exams, advocating for reforms within the National Medical Commission, and successfully pushing the barcoding of medicines to improve patient safety. He also played a pivotal role in bringing communication into the medical curriculum and working with IRDAI and NABH to make entry-level certification a standard for hospital empanelment. But beyond these life milestones lies a person who has navigated crises like the COVID pandemic, built new institutions, and dedicated himself to the causes of integrity, patient safety, and the future of Indian healthcare. Today, we'll explore his journey, not just big policy battles and institutional reforms, but also the personal values, life lessons, and anecdotes that have shaped him along the way. Dr. Thomas, it is indeed such an honor to welcome you to the Luminary Lounge today. Thank you so much for making time.
Thank you, Aruna, and thank you for those kind words. Whatever I did was as a team. I just happened to be there and getting the credit.
Well, sir, you've been a leader. So, we want to know more about how it all happened. So let's, I'm quite curious, sir. You've dedicated over 4 decades in healthcare. What did young Alexander dream of becoming? Was medicine always a plan, or did life have other ideas for you first?
Yeah, a very interesting question. Actually, we are from a middle class family. My dad worked in the coffee estates in Chikmagalur. So the highlight of my life was going there for holidays. And we were surrounded by animals. We had wildlife, we had domesticated deer, we had rabbits, we had squirrels, there were a couple of peacocks, dogs, cats. So I actually wanted to become a vet. But then fate willed otherwise. And those days, that we had very few choices, medicine or engineering or a teacher. And well, there was nothing particular. There were no I was the first doctor in my family, so parents were also keen to make me a doctor, and
I see.
I was also interested. Didn't have any aversion, yes, but my first choice would have been to be a vet.
A vet, lovely. But did you actually have any hands-on experience at being a vet while you were growing up?
No, I used to when cows were delivering, I used to be around, but maybe about 7 or 8 years ago. There was an incident where a lion in Bannerghatta, the Bannerghatta
National Park.
The national park, it developed, I think, sort of a paraplegia. So they actually called me to have a look at it. So we went in and had a look at it. We had planned for an MRI, and in fact, Devi was very kind enough to allow the MRI in NH. But then before that, unfortunately, the lion passed away. Had a lot of pets, but now we stay in an apartment. So I
can't have many.
Yeah.
Oh, okay. That must have been quite adventurous, coming face to face with a lion, having to treat it.
There were bars between me and the lion, so it was okay.
Right. So those early years at CMC Vellore must have been indeed very formative for you.
Yes, actually, even before that, I studied in Clarence. So it's a school in Bangalore. So most of my classmates were from Bangalore. They're from Bangalore East. And then
Okay.
I joined JJ Medical College, Davangere. So that toughened me a little bit. We had people from all over the country, and that
Right.
actually exposed me to a little more than the cocoon I was in. Then, of course, CMC, yes, CMC was a totally different ball game. I didn't know I had so much of physical endurance. I mean, looking back, not a very good idea, but sometimes I used to work. I worked 6 weeks with probably 1 or 2 hours of sleep every night when I was in my hand surgery posting. I
Oh
lost
my
8
God.
kilos, but then it tested my physical endurance. Those are not good things now, but then CMC taught me a lot of other things also, and that the patient
Mm.
was first. Enjoyed
Ah,
interacting with people from all over the country with a similar background. It
right,
was good. I
right.
enjoyed it. And most importantly, I met my wife there.
Ah, well, that makes it all, worth it all.
Right.
Right. But beyond medical training, I mean, has there anything that sort of left its mark on you at CMC, other than, of course, finding a future wife? But is there anything else that you say when compared to JJNMC and CMC? What is it that you
think
really sort of learned?
work culture was very different. And
Hmm.
maybe in a way it wasn't too healthy because we were only focused on patients, patient care. Didn't have too much else, which I think looking back, maybe for a all-round development is better. But yes, I enjoyed those days. I enjoyed interacting with the patients, and we had giants of teachers. We had Dr. M.V.
Yeah.
Daniel, Dr. Selva
Hmm.
Pandit, and interacted with many people who came to visit.
Right, right.
And
Any one of them have left an indelible mark on you and on how you saw the world?
yeah, I think all of them, and in particular Dr. M.V. Daniel. He was my professor of orthopedics.
Uh-huh.
He's alive. He's close to 90. I visit him, try and
Okay.
visit him once in 2 years. But then he
Oh,
taught me the importance of being on time, being dependable. And
mm,
orthopedics, one thing we do is scrub, and scrub the patient. No? So
yes.
that is the importance of that, or basic principles which we try and follow, but it helped me a lot. And
Okay.
of course, even when I was there, I used to also intern with Dr. K. Srinivasan. He's from Bangalore. One of our,
Ah,
yeah, he was my teacher. He's another mentor. Very
right.
soft spoken, practices.
Oh, the Srinivasan sir who is in Malleshwaram right now?
Yes.
Oh,
Yeah, and
okay.
he taught me a lot of things. And the most important thing he taught me was when you make a mistake, please tell the patient you made a mistake. And in
Hmm.
fact, he taught me a lot. And in addition to what I learned from CMC Well.
Yeah, right. I've had the fortune of meeting him several times because I grew up in Malleshwaram.
Oh, okay.
Yeah.
Right.
And so you've worn so many hats as a surgeon, orthopedician, administrator, policymaker, teacher. Which role feels most natural to you? And which one taught you the most about people? What do you
Oh,
think? I
yeah,
mean, because every role has its own special set of skills that you need to.
absolutely, yes. I think all the roles as a surgeon, you used to get immediate, tangible results, which is very satisfying. As an administrator, used shaping institutions, and I'm very glad I was part of a team which actually made Baptist Hospital one of the leading hospitals in the country. It was a
Yeah.
very average mission hospital before that, but I had a fantastic team. Then
Hmm.
policy, probably the toughest, gives you lots of, makes you learn patience, gives you a very thick skin. But if you are persistent and have the right intentions, it will happen. Teaching, of course, teaching my students was another area where I used to enjoy. And I remember my days in Baptist. As director, we had a lot of issues. I had a lot of issues. So the best place to relax was going back to the theater and operating. And that's what we were trained for. Then, of course, the other area was capacity building, writing
Yeah.
these books and coming out with courses for medical people. And I think God has given me a special gift of networking, and that's how we were able to
Hmm.
come together in so many areas. And yes, I enjoy talking to people and networking.
Right. But what comes most natural to you? Networking, and then how do you get things done? Like what teaches you resilience and persistence?
So I think first is you network people, and then you sort of over the years you get to assess people. Then you get
Right.
to sort of know who are the people on the same page, get to know who are the people who will deliver. Some people you
Hmm.
need to be a little more persistent. But I think one thing in common is if you're persistent and if everybody knows that you have no hidden agenda and that
Yeah.
your intentions are good, things will move forward. It may take a while, but it will happen.
Hmm. Okay, so you have to come across as somebody who's dependable, accountable, and persistent with very sort of honest, authentic sort of ideas. That makes
Absolutely.
all the
It
difference.
makes a big difference. Yes.
Right.
And that doesn't come easy. You probably have to know a
Hmm.
person for 3 years before that
Yes.
happens.
Yes. True. True. Absolutely. So, you must have seen people at their most vulnerable moments. What has medicine taught you about human nature? What has policy making or capacity building taught you about human nature?
I think in every person there is some good, and what you need is to try and get it out. Good
Hmm.
is covered with a lot of other things, but I think if you're able to reach out, and I think in that journey, I think they realize that the most important thing that all of us, including me, is that we need to be grateful and gratitude, and
Yes.
thank God for all the good things, and then you have a positive attitude. A negative
Yeah.
attitude will give you a lot of issues, including ulcers. So I think you need to be positive and
Right.
yes, and
Yeah.
patients who come to us are at the most vulnerable, and when they're vulnerable, I think it's very important that you communicate confidence to them, you communicate empathy, you communicate compassion, and it's getting better now. But I think that's one area where, as a medical profession, we need to improve,
Hmm.
because most of us are a little hardened. We see trauma, we see death, and sometimes
Yes.
we
Yes.
forget the what's actually happening.
True. Absolutely. I think, yeah, the empathy is something that cannot be taught, unfortunately. So I think even including empathy and compassion as a subject in medical colleges, do you think that makes any sense?
I think it will come naturally once you learn the art of communication. So that's why I spend
Yeah.
so much time in communication, because unfortunately, and orthopods especially,
Yeah.
our communication leaves a lot to be desired. And I think once you start learning appropriate communication, you train yourself, then I think automatically as a doctor, empathy will come, compassion will come. And I think one of the
Yeah.
most important things that we doctors need to register is that we need to listen. You're always in a hurry. I think
Yes.
and that's part
True.
of communication, listening.
True. True. What's something that about yourself that would really surprise people who only know you with your professional reputation?
Yeah, I joke and play around with the grandkids, grandkids a lot, and with the family. And
Okay.
yeah, I may not appear very religious, but I am very religious because of a lot of things
See.
which have happened in my life. I depend a lot on
Okay. I
uh,
see.
God, do a lot
So
of
Sunday church,
not
reading the Bible, that sort of thing.
not church may not be every Sunday because of the traffic, but it's more faith in God, faith in God.
Ah,
And I remember in Baptist, I mean, we had a lot of problems there. We were a upcoming hospital, and because of the various issues that we had, we were not able to get the best talent. But God brought the best team together, and a lot of things we were able. And at times when I didn't know what to do, I say, yeah, God, you put me in this position, it's up to you to sort it out. So,
yeah,
and it
right.
worked, and it worked.
It worked. Okay, so true faith does work, and
Yes,
patience, of course.
yes, yes.
Yeah. So now coming to a little bit about your leadership and institution building roles, you
Yes.
founded organizations like the NBAI and the CAHO rather than just working within existing systems. And these are such an important aspect of patient safety. What drives someone to build institutions? Is it frustration, vision, or something else?
See, to be frank, I actually, looking back when we started these, I'm saying we because there are a few other people involved. We never ever thought that we'll reach this stage. Uh, Actually, the first seeds of this were planted when we actually had a dispute with the National Board of Exams. I don't know whether you remember, but suddenly out of the blue, they said the selection will be done by us, not by you.
Yes, yes,
Looking
yeah.
back, it was a good idea, but then they never used to communicate.
Hmm.
Those days, even if a CEO went, he had to wait outside the National Board office. So we
Hmm.
formed an organization. Initially, there were only 3 hospitals, but that became bigger. So the initial objective was to get together, but then we have gone way beyond that. Similarly, AHPI also, we got
Yeah.
together because we felt there was an umbrella body required for hospitals. ANBAI was only for postgraduate teaching
Hmm.
institutions. Similarly, CAHO we thought would actually coordinate with NABH. But I think
Right.
all initially was to get together and to be more of unified voice. But I think all three
Okay.
organizations have gone way beyond that. And I must
Absolutely.
confess, at that time, we didn't have any. The only objective was to get together and make our voice heard. Similarly, with Vaya Vikas, which we actually started recently for senior citizens.
Uh-huh.
We've got together the senior citizens, but we've gone way beyond just getting them together. Policy
Okay.
decisions, interacting,
Right.
getting involved, getting them involved in physical meetings, cyber
Okay.
security, teaching them law, etc. So
Well, that's amazing.
it's
So,
it
sorry,
evolved.
I wasn't aware of the Vyas Vikasa. So, is it like like an association, or do they all meet
Yes, it's
physically, or is it?
no, it's actually when I was in Baptist, the Planning Commission had reached out to me to do some work in senior care. So I
Uh-huh.
was at that time maybe 55. I'm talking about more than a decade ago, almost 2 decades ago. So I thought, oh, India, our culture is so good. Seniors will be well taken care of. But when we dug deeper and in the urban areas, it was horrible. I mean, seniors were being very badly treated, not
Absolutely.
dignified, being fooled by their
Mm.
own children. And this is about 10
Mm.
years, 10, 15 years ago. So
Mm.
we had a very strong program in the villages. So I said, okay, let's look in the villages and see how it is. But unfortunately, there it was even worse. And we have
Oh.
had parents being put in the cattle shed and not
Yeah.
being allowed to interact with the families and others. So I had this idea. We made a report for the Planning Commission, and ever since I've been trying to get organization of senior citizens together. Like in the US and Australia, they're very powerful. Large numbers.
Yes.
They also influence policy. But then I think funding was an issue. So finally, I think it was 3 or 4 years ago, I got in touch with Devi and me do a lot of things together. Devi Shetty and myself.
Okay.
I
Okay.
spoke to Chris Gopalkrishnan. So the three
Right.
of us got together. Chris funded it. I think that was the main thing. Now we have a very strong secretariat. We have about a 1.25 lakh members. Give them a lot
Okay.
of services. We don't provide all the services ourselves. We actually work with other organizations. We are
Mm.
hoping that in the next 2 years we'll have 2 million members, and we
Wow.
will be able to influence policy. In fact, the recent decision of the government to include seniors, all seniors below, I think it was, we had asked for 75, they said 65. So they come under the PMGY. They don't have to pay anything. And plus, we are
Yeah.
working with the IRDA to get them a special type of insurance. So
That I so when you have to make a mental map of how to go about it, do you have a process, sir? How do you know, because it's always a process, some SOP that you might follow. So when you started thinking about it, you just talked to people and got it done, or was there a
no,
like a mental map that you put?
I'm a quality guy. I work with NABH, etc. And Baptist, we introduced a lot of SOPs. No, but no, there were
Right.
no SOPs for this. I think the most important thing is like-minded people got together,
Yeah.
and we kept it like that, and that circle grew, and that's how it's been
Okay.
successful.
Oh. So during your time shaping the healthcare policy from Karnataka to the national level, you must have encountered significant resistance, right? How do you handle people who don't want change? And there must be so many in that league. So bureaucracy, sort of, let's say conventionalism. How do you handle these things? Like,
Uh,
yeah, on a regular conversation level.
it's difficult. It's actually it takes time. It is a process. See, in the government, the bureaucrats are very intelligent, very well trained. But then I wish there were more people who would actually take proactive decisions, because each bureaucrat has potential to actually make huge changes. And I've been fortunate that I've been able to interact with them. In fact, all the health secretaries in Karnataka, we've had excellent people who really were proactive. Yeah, but there are issues. I think the first thing is that bureaucrats tend to think they know it all, some of them. So there again, the formula is be persistent, show them data, and tell them
Yeah.
that there's no hidden agenda. And most of the
Right.
times it's worked. Most of the times it's worked.
Okay. Okay. but you probably need multiple meetings, rapport building,
Oh,
and
yes,
then,
yes, yes. No,
yeah.
I think I have a strategy. Like as I said, I work a lot with Devi. So Devi has the
Ah,
charisma, and I do the
yes.
behind the scene work. So together, I think we've
Okay.
been able to carry off quite a few. But yes, it needs a
That's
lot of
great.
persistence
Yes.
and passion, because at times you
Hmm.
tend to get frustrated.
True, true. Right. Well, so you've led in crisis situations like the recent pandemic, the COVID pandemic, and in boardrooms. You've led in several sort of forums. What's the difference between leading doctors and leading bureaucrats? Do the same principles apply? Do they think differently? Of course, we speak for doctors, but do they understand the pains of a doctor? How do you see the difference? So when you're addressing a leading doctor as compared to a leading bureaucrat, is there a different a strategy that you use?
Yeah, see, unfortunately, our medical education is a little warped. And we generally, we medical doctors, we focus only on the profession.
Yes.
We manage our finances very badly. We don't know much about the rest of the world, and that is a weakness. So dealing with doctors, sometimes you have to educate them. Like climate change is an example.
Hmm.
I go to the leading doctors, and they don't know what it is. Then we have to educate them. Whereas, but at the end of the day, I think they listen. It's a process of education, and the reason that they're not aware of these things is because they're so committed to their profession. I think that needs, and even in our, if you look at our education, we are so overburdened that we have very little time for anything. And
Hmm.
for a personality to mature, I think there should be a little bit of education in all spheres, in finance, in law, in climate change, in policy. And that's what we are trying to do with the new
Okay.
MBBS people. It needs to be balanced, which is not the case now. Whereas bureaucrats, I think India, we're very fortunate. The process of selection is such that you get the most intelligent guys as
Hmm.
bureaucrats. And yeah, they handle things differently. They know they're in a position of power. So sometimes you have to use strategies to get them to understand. But both doctors and bureaucrats are intelligent people. They can do a lot. And I think we need to also focus on how we can get the medical professionals to do. Like when I was in Baptist, I used to we had a fantastic bunch of consultants.
Hmm.
And they, I mean, I made sure that they were not too busy. They worked, we had residents, etc. I got them
Right.
involved in planning a building, planning the private ward, writing a book, a lot of other activities, and they're brilliant guys because they're so intelligent. And one of the reasons Baptist became an institution of excellence was because we got all their inputs, not only in medicine and other areas.
Right. So, in all your time in Baptist, CMC, Vellore, have you seen a change in the way students, youngsters, handle the course and the passion towards the course, the resilience that is required during their internship and post graduation? Have you seen any major changes happening, sir? Because I
I
seem
think,
to have. Hmm.
yeah, I believe. See, I've not been in active teaching or in practice for the last 5 years. But during my time, I think all the postgraduates who came, whether it was our own selection or whether it was a selection through the national board, I think it's important how you deal with them and what is the culture. Because I think the students at Baptist, initially they may have been a little adjustment problem, but all of them turned out to be quite dependable, very competent, and empathetic and compassionate. But I believe that in the last few years that is changing. But I think the fault is also with us as
Hmm.
teachers because we need to handle them correctly because the world is a different place now. It's not the
Yeah.
same as it was when we were. And when I say we, I
True.
say you. You're still a youngster. Things are
Eh,
different.
Nah, there's a moment, like a monumental shift, even in the way they want to. For example, nobody wants to do obstetrics, core obstetrics. They all
Yeah.
want to do fertility and laparoscopy, and nothing which will take their nights out of their sort of work-life balance and stuff.
But I think that is
Such.
also the fault of the community, the society, because your specialty is the most stressful. I remember my gynecologist in Baptist. they had no option there, but they were under tremendous stress. And I always say most of them are lady gynecologists. They have 2 shifts at home, then they come to the hospital,
Yeah. Yeah.
and it is stressful. And anything can go wrong. Consumer
Yes.
forum at the drop of a hat, cases are. So I
Yes.
wouldn't
Yeah.
blame them. So I think society needs to change its outlook, because you start
Yeah.
this sort of litigations and stress, it will ultimately harm the community itself.
True. Absolutely. So, coming to a lighter sort of topic, can you tell us about a patient or a moment in your surgical career that changed how you practice medicine? Something that made you think, I need to do things differently?
Yeah, I think one case which I wouldn't forget. I just come fresh out of Vellore. Not maybe 2-3 years I was working here, and I was the sole consultant in orthopedics, handling trauma. My surgical colleagues used to help me. So we got this young boy, 12 or 13 years old, run over by a truck, came very sick. We salvaged him. He was almost on the road to recovery, and it was a team. We had a plastic surgeon, we had
Yeah.
a physician, etc. And the plastic surgeon, one of the team members, was very rude to him consistently. And I was a junior guy; I couldn't do much, even though I was in charge of the patient. Unfortunately, he died due to a thromboembolism.
Oh.
And because of that communication gap with my colleague, the family went up in arms. They filed police cases. They went to the consumer court. So it took us almost 7 or 8 years. I mean, nothing medically was wrong, but looking back, we could have handled it much better. And that is where my interest in communication came, because it was basically a fault in communication. And later, when I took over as director of Baptist, again, I told you I'm an NABH guy. We do analysis, what is risk assessment and all that. And I discovered that communication, inappropriate communication, was causing most of the problems with patients, with the interdepartment, with stakeholders. And that's when I decided to get a little more into it, and got into that early. In fact, that book, Communication Cure, Care Cure, was my first publication. Initially, it was just meant to be a handbook for the hospital, but it turned around things so much that I said I shouldn't keep it for myself. We should share it.
Oh, that's lovely. I still need to get my hands on it. I will.
Fourth edition is coming out in probably in October. And we've already got a pre-order, this thing, of about 9,000 copies. It's used widely. It's used widely.
Is it on Amazon?
Yes. But I suggest you wait till October now.
In October,
yeah.
Will do, sir. So you've received recognition like the Waterfalls Global Award for the healthcare sector 2022 by the government of UAE, Emeritus Teacher Award by NBE, India Lifetime Achievement Award in 2018 by CAHO. Firstly, what do you feel, or what do you think is the most important or worthwhile achievement so far? And I'm also curious about the setbacks. And what's been your biggest professional satisfying moment and disappointment, and what did it teach you?
I think the awards, etc., as I said, no, it was a team. I just happened to be there and got all the credit, which sometimes is not fair. But I think the satisfaction of working together and impacting so many people, especially during COVID, it was very satisfying, and we all felt good. At the same time, during COVID, we lost so many of our colleagues. And in fact, I remember, I'm sure you remember, there were no hospital beds, and to spend most of my time trying to get beds. And I remember one particular example where a known person was outside the casualty. I won't name the hospital. And we were trying to get a bed, waited about 2 hours, bed was available. And then as he was being shifted in, he passed away. Those were scary times. And but at the same time, during COVID, we lost so many of our people, and some of them, doctors, nurses, and the nurses and the paramedical workers are the people who actually suffered a lot. We tried to help out in whatever way possible, but it was difficult. And at one time, there was so much anger against the doctors. I remember the time when one of our colleagues who died was going to get the funeral and going to the cemetery. They didn't allow him to be buried. So those were all very frustrating. Yeah, there was an agitation saying you can't bury him here, and then the police had to intervene. Those were very frustrating times because we lost a large number of people, and the community knew about it, but in spite of it, many of our ASHA workers were attacked. But anyway, I suppose it's all the game. Ultimately, we got through it, but those were scary times.
Must have been a lot of challenging, operationally challenging, and probably ethical challenges as well that you faced around that time.
Yes,
Yeah.
there were a lot of. But the good side of it is, I think we were able to accelerate the use of technology. I remember just a day before the lockdown, we were with the government of Karnataka and talking to the deputy chief minister and the health minister, saying that you should allow telemedicine. At the time, the government was they were not allowing it. And we had given them some guidelines and told them how to do it. Next day, unfortunately or fortunately, this struck and they opened it out pretty fast. The other thing is, I think the COVID, during COVID, the HPI became very strong. Because we were meeting every week. I mean, we were a very loose network of state chapters all over the country. But with COVID, we met every week. In fact, we probably knew what was happening on the ground better than the government. We were able to interact. We were able to help the smaller hospitals. And that strengthened the HPI to a great extent.
Okay. So ultimately, regular meetings is what keeps us together, united. Kind of.
I think for doctors, it's when you're pushed against the wall, you get together.
Yeah, that's true. That's true. Yeah, well said. So you developed white papers for reopening sectors like the air travel and schools. How did you approach building consensus among such diverse stakeholders when everyone had different priorities? So, I mean, it's really impressive, sir. We've done so much in so little time at such high level with so many stakeholders. Hats off to you, indeed. I'm really in awe of all that you've achieved. How did you manage this?
Okay, that's a very interesting story. So after COVID, I had a few friends in the airport and some senior teachers. So the airport guys came and said, people are scared to travel. So what can we do? So that's how we got a group of experts. We got infectious diseases, we got airport managers, we got Ministry of Health, we got an APH. And that was very useful. It actually built confidence among the travelers who are using. But then closely after that, some of the schools approached us because the parents were not willing to send kids back to school. So again, how did we do it? We first got the best people, even for the airports, the document, we got the best people in the country, CMC, All India Institute, the teaching fraternity, we got the top people, the administrators, got them together. And I think the agenda was very simple. Is it safe to go back to school? I think everybody was clear on that. So how do you do it? And that's how it worked out. And in fact, that had a huge impact because soon after that, the Ministry of Education, Government of India, they approached us and said that in some of the states where we have opened up, we're seeing a high incidence of mental health issues in children. So as a result of that, I was part of a committee. I think I was convener of a committee by the Ministry of Education, where we trained 40 lakh government teachers how to actually pick up mental health issues and to recognize, etc. So it really worked well.
You trained 40 lakh?
Yeah, through there's a portal. I think the name of the portal was, I'm trying to remember the name of the portal. It's in the Ministry of Education.
All the teachers, you mean, sir?
Teachers, yes. Yeah, all
teachers.
The teachers, yes.
Oh my God, that's
it
massive.
Took us about a year and a half. And then they in turn actually impacted so many more students.
Now that mental health, I mean, that was a silent pandemic during the pandemic.
Yes. I think it's still
pandemic
happening,
in a pandemic.
Yes, absolutely.
Right.
So that was very nice ending to a long and very frustrating and heartbreaking story. I think with things getting back to normal.
Yeah. And then, of course, another topic which is probably very close to your heart, as chair of the Health and Environment Leadership Platform, you worked on climate change and healthcare. what practical steps would hospitals need to take to balance infection control needs with environmental sustainability? Anything, any practical tips?
Okay, I think the biggest step there is the awareness among the healthcare professionals. We know very little about climate change and the relation to the health sector. In fact, I don't know, Srinath Reddy, Professor of PHFI,
Yeah.
we were working with him. So I think about 7 years ago, he asked me whether I would chair this. It's called Health Environment Leadership Platform.
Uh-huh.
So I asked myself, and I asked him, what's the big deal? Why do you need to connect both? And then as I took over and I learned the close connection between the health sector and climate change. The
Yeah.
situation today is that probably 5% of us, especially doctors, talk about this. I think so. The first step is to try and sensitize them. We've got about 300 to 400 hospitals as our members now. We've got a robust network through HELP. And in addition to sensitizing them, we also handhold them in how to conserve energy, how to use water carefully, how
Wow.
to prevent pollution. So, and I think
Okay.
we've written the first book on health sector and climate change, which is being used by many hospitals as they operationalize this, especially the big chains.
Okay. As an individual practitioner, what can I do to help reduce let's say, I mean, yeah, for climate change, to improve climate change?
I think one thing is, as a leader, if you can sensitize your patients, because we are leaders, and then small things like putting off the light when you're not using it, conserving water, how you deal with biomedical waste,
Waste.
and the use of plastics. That book is available actually as a free download. It's called
Okay.
The Health Sector and Climate Change. So
Okay. Right.
that gives I got people to write out different aspects. So that is
Right.
a very simple guideline for healthcare professionals and health workers as to how to help.
And that's very much a part of the NABH now accreditation,
yes,
isn't
yes.
it?
Where we help them come up with
Yeah.
some green standards also.
Okay. Lovely. Right, sir. Sir, leading through crisis like the COVID must have had an emotional toll. Like you said, you lost so many friends and colleagues. How do you process the weight of decisions that affect thousands of lives? Do you have practices that help you cope on a personal level on a daily basis?
I think there again, as I'm going back to my faith in God, and of course,
Yeah.
family makes a big difference. My wife keeps me grounded, family, and of course, friends. But I think the main thing is your faith in God. What you've learned, you try and put into practice, keeping in mind that that you try and impact the community positively.
Okay. So faith in God always, yeah, kind of cushioning the trauma, whatever it may be. Yeah, I suppose.
Yeah, I think otherwise, I don't know. For me, it would be very difficult if I didn't have what do you say, something to fall back on. Because many times in life we have it, and of course, family is very important.
Yeah.
Fall back on them, fall back on
Yeah.
what you trust
So-
in.
Right. So outside of hospitals and policy meetings, what brings you joy? Faith, of course, but how do you recharge after dealing with life and death decisions? Is there any hobby that or passion that you,
Oh yes, I
sort of
love
fall back on?
playing with the grandkids. I think when you reach
Yeah.
this stage, you'll realize it's a totally different ball game. You really let go of yourself when you're with the grandkids. There is one thing. The grandkids are here for a little while, so we really enjoyed. And the technology helps us keep in touch with them. That's
Yeah,
one thing.
yeah.
The other major hobby I have is gardening. We do a lot of gardening. I have a rooftop garden.
Oh,
And do
nice.
this and that. Very relaxing. And my morning
Yes.
walk, I do a little yoga and do a little gardening.
Right. So your day is very scheduled, very disciplined, isn't it? You've
More or
got
less.
time for everything.
Yes,
Lovely.
more or less. Including a time for a movie every day, a short movie.
Oh.
Yeah.
Oh, nice. Okay. So, what books and ideas and experiences outside of medicine have influenced you most, especially your approach to leadership in life? Any books that you would recommend? Or
I'm not that much of a reader. It's mainly from mentors that I learned. Actually, I was an NABH assessor, and I picked up a lot of practices inspecting the various hospitals.
Yeah.
Also as a national board examiner. and I was able to put that in practice. And yes, from the Bible, no, actually, the Bible is a very nice storybook. Gives you a lot of
Mm-hmm.
stories, gives you a lot of parables, gives you a lot of
Yeah.
instructions, and it's like all religions. It's basically tells
Yeah.
you that you love one another, and I think that message, which I'm sure is there in the Gita and in the Quran, if you follow that, life will be much less complicated.
Right. Absolutely. And I think you're right about, I think any anecdotes, any stories that have some moral, those are some things that we have to tell our grandchildren or grandchildren as well.
Uh-huh.
Otherwise, I think it's all going to just become thin air.
Mm.
Somebody was recently telling me that unless you uh, give down those values in forms of parables or folk tales, whatever it may be, I don't think they're going to learn the values, and you wouldn't be able to do it in any other way. Although you live by example, isn't it? So
I
all
think it's
those books,
important, yes, especially now in this time of technology. I think we have
yes,
to
yes,
leverage technology and use it
yeah.
as much as you can, but especially for us as medical professionals, that the
Mm,
touch, the
mm,
caring touch, the empathy, that's something that we should
yes.
never ever forget.
Sure, sir. So now that India is transforming dramatically, I mean, it has transformed through your career. What changes in the society, not just healthcare, have surprised you the most? And what gives you hope about where we're headed? Do you think AI in healthcare is going to be a boon or a bane? And if it's going to be a boon, what do you foresee in the next, let's say, 5 to 10 years as a healthcare professional? I'm very curious to know what you think.
Yeah, I think ours is the generation which has actually seen it all. From the time we had to wait for 5 years for a Fiat car, 4 years for a telephone, to now you have so much technology. You don't even, I've forgotten the last time I went shopping. I remember when I was a kid, every Sunday was going to the market buying meat and provisions. But now things have changed. Everything comes from technology has been so especially in Bangalore. No, in fact, even abroad, it's not as good as we are really
Yeah,
spoiled in Bangalore.
very much.
AI, I think technology and health, we do help a little bit. Quite a few technology companies. We have written a book on technology because generally, as medical professions, we're a little slow, we're a little insecure about technology. We've written one book on that, and I think the important thing is use technology and AI because it will definitely bring down the cost. It will definitely help accessibility of healthcare, especially to the rural population. But in
Mhm.
all this, we must remember that at the end of the day, our calling is to be compassionate, to be competent, to be empathetic, and we must never forget that. AI
Yeah.
is already making changes. We help a startup in radiology. Now,
Uh-huh.
what a regular radiologist used to do in a week, with AI, they do in
Mm,
probably 2 hours.
yeah.
And it's I think the accuracy also is probably a little better than radiologists, and it also
Mm,
helps the radiologist focus on issues which interest them. But it has to be a balance. Too much of anything is not good, and we, especially as healthcare professionals, we have to keep in mind that the patient comes to us for treatment for his life, and we have to give it all we can. In
all
fact,
you
when
can.
in Baptist, as director, that was my school. Patient is central to whatever you do, and everything else is secondary. And I think we need to keep reminding ourselves about it. Sometimes we tend to forget.
Mm, true. But when you say AI can actually help us, reach the unreachable, because I've heard of several podcasts and books, read books, which say that the disparity is going to increase between the rich and the poor, the urban and the rural, and it's going to be a little bit of a dystopian society with AI coming in. But when you're saying that healthcare will be able to reach the grassroots, how do you foresee that happen, sir?
Simple thing like telemedicine, no? Because now
Yeah.
a person in a village has access to the best specialist in the sitting in town.
Hmm.
That will be one area. And then I was just reading, we are involved in the robotic guys. So where a guy was sitting in one place and doing surgery about 400, 500 kilometers away in a secondary care hospital, which you normally would not have been able to do.
Hmm.
Yes, we have to be careful that universal healthcare is something we all have to achieve. And I think that way in Karnataka, we are quite blessed because I've seen the poorest of the poor who has had the best treatment through the government schemes. Of course, that's a whole
Okay.
different topic to talk about. But I
Hmm.
think if the Ayushman Bharat is actually implemented
Hmm.
fairly, and when I say
Hmm.
fairly, it's very unfair now because hospitals are getting less than the actual costs they spend on the reimbursements. If it's
Hmm.
actually implemented, keeping in mind the sustainability of the healthcare providers, I think all our citizens will get world class care, affordable and accessible.
I really hope we can leverage AI and technology to achieve this, let's say, uh, not a dystopian world, but some sort of a harmonious world. I mean,
Yeah,
that would
there has
really
to be a
help.
balance. There has to be a balance. If
Utopia.
there's no balance, yes, there will
Okay.
be some bad outcomes.
Yeah. So let's talk about a little bit about legacy. You're still actively engaged rather than retiring to a quieter life, which is amazing, and also balancing work and family and hobbies, etc. What keeps you driven, sir? What's left undone? Does that motivate you, or is it just you know a matter of just carry on the flow?
Yes, yeah, I've actually, in the last couple of years, I've got into lifestyle medicine. We've written a book on lifestyle
Ah,
medicine. So
amazing.
one of the things it teaches you, and I've seen it with my own eyes, that once you stop working, it's a rapid decline.
Ah,
That's one thing. But the second thing is that I think at this age now, I'm close to 70. I think I've got a lot of experience in getting things done a little faster, more effectively. And I think
ah,
that should not go waste. So we're
yes,
trying to utilize that. At the end of the day, and I tell my youngsters this, end of the day, it's how are you going to, how have you impacted the community
yes,
around you? And
yeah,
that's, I think it's important because you owe it to them. God has been good. I've had a very good life, and I think it's time to give back. Generally,
yeah,
I think our
true.
medical professionals in India, we have a fairly comfortable life, and I think at some point we all need to give back. And
Goodbye.
our country is really on a really flying high. I think in a year or two, maybe a decade or two, we'll become a superpower. Fantastic people, fantastic resources, fantastic opportunities. Actually, we have been a little fortunate. See, sometimes working with government takes a long, long time. This barcoding that you were talking about,
Yeah.
I think 2016 we started working on it. We faced so many hurdles. The drug controller was, because we pressurized, he had a meeting and then came out of the meeting saying, no, everybody said it's too expensive. It hardly costs 2 or 3 paisa for a strip. But we kept at it. And I think just 2 weeks ago, the government announced barcoding for a list of 300. They're hopefully going to make it for all the
Wow.
drugs. Sometimes it's
That's
actually
great.
quite frustrating, but two very, I think, encouraging things have happened. We were
Mm.
actually responsible for the MCI being dissolved. There was so much of corruption, we thought
Yeah.
at that
Yeah.
time. So we actually lobbied for a new body, the National Medical Commission. But there has been a disappointment, an absolute disappointment. So we were actually trying to lobby for change. We wrote to the Prime Minister. Initially, there was a lot of response, but last year or so, not the response was not what we expected. And
Oh.
we wrote because a couple of mission hospitals were harassed about. They made the staff stay overnight. They asked for money, etc. So we again took it up, wrote to the Prime Minister. Fortunately for us, I think the CBI raids came. I think about 38 people were arrested. And then I think the Prime Minister's office took note. And what we had said there was that the National Board of Exams is an example of how to have an organization which is transparent, which is efficient, which has a good reputation. And we never thought in our wildest dreams that the head of the National Board of Exams, Dr. Seth, who's an absolutely amazing person, very quiet, doesn't talk too much, but get things done. He's been appointed the chairman of the National Medical Commission. So we hope
Oh.
that there's going to be change.
Oh.
Then Dr. Ramesh from Bangalore, he's
Uh-huh.
somebody also we rooted for. They're people of integrity, people who actually, uh, I think they'll add a lot of value. The second very encouraging thing, it didn't happen because of us, but we had worked very closely with Mr. Ajay Seth, the health secretary. He was in Karnataka. and then he became finance secretary, and he's now been appointed the chairman of the IRDAI.
Oh, okay.
So I think they're two very important appointments, excellent
Sure.
people, and we actually hope that a lot of things will happen.
Yes, sir. So, you've done tremendously wonderfully with so many different aspects of healthcare and professional development, patient safety, etc. What about research and development? What about research, sir? Because unfortunately, with AI coming in, it's very much topsy turvy. It's very much heavily biased towards research from the US or the UK or China. How do we Indian doctors help AI by giving them Indian based studies? What do we do? Where are we headed in that regard?
Yeah, so actually, there's one area that a couple of things I did not mention. One is we work very closely with ISRO, the
Oh, yeah.
Indian space. So how it happened was many years ago, Dr. Rangan and me worked together for the public
Yeah.
health policy. So he
Yes.
was asking me, what is your mortality rate? So when I told him it's probably more than 9 to 10%, he was astounded. But he said, in ISRO, we have zero errors. They can't afford to make any mistakes. And he said, what is more important than human life? So he connected me to the chairman at that time. And we, along with the Society of Emergency Medicine and the ISRO engineers, came out with a document called Health Quest, trying to say how we can improve the functioning in the accident and emergency departments. That they took to a national level. They did a study that has been introduced into NABH and others, and it definitely made a difference in mortality and morbidity. So as a result of that, we now have a formal agreement with ISRO. It took about 2 years because they had to go to the PMO, where we worked with ISRO. We are now working in various areas of research. We are looking at geotagging all the healthcare organizations, the blood banks. We are looking at
Okay.
coming up with an artificial intelligence workshop. We are looking at an intelligent upper limb prosthesis, making it affordable for India. We've just
Okay.
developed something called Clinostat, which costs about uh, 18 to 20 lakhs, which is now made in India for about 60,000 along with InStem. So there is scope for it.
What is that, sir? Clinostat.
It's called Clinostat. It actually creates a zero gravity atmosphere, so the research can be done in that. Because now people,
Ah.
since we're sending more people to
Yeah, right, right.
space, so there is
Right.
a lot of scope. We're working with them. Then, in addition to that, we are working with the Indian Institute of Science and in STEM. And my area of interest is sarcopenia and muscle weakness. So we're doing some cutting edge research in that. But I think the question to us medical professionals, how can we improve our research? We need to tie up with ICMR. They've got a lot of funds. They're a little more organized with ISRO, public-private collaboration. There is a lot of scope. I think we have to leverage that. But it's a very important aspect of
Yes,
the medical
true.
profession in India. I also wanted to add one more, I think, an important. If you ask me what are the three or four most important things that we have done which has had impact, one is the communication, which has now gone into the curriculum, and I think on a daily basis, 2.5 to 3 lakh students are being trained. I think it'll help in many ways, the trust between the patient, violence against hospitals. The second is the entry level certification of hospitals, especially in the two-tier and T3, the smaller hospitals, which will help give the patient some assurance of safety and quality at the grassroots.
Right.
And I think the third and very important thing we have done in Karnataka is we've been able, working with Anbai and Government of Karnataka and the National Board, we've been able to transform all the district hospitals and some of the taluk hospitals into postgraduate teaching centers. In fact, the IIM has actually written a document on it, which is going to be released on 7th. I think through that, we've impacted millions of people in Karnataka because you have specialist care in the districts. And again, it's all been possible because of collaborations. Collaborations are so very important.
Yeah, right. And at your level, as you said, things happen with a snap of a finger with your wide networking and over the years. I mean, no, it's just not important to network at one level, sir. It's like important to maintain those
Yes,
relationships as well. And
yes,
that requires a little bit of nurturing. How
yes,
do you do that nurturing? For example, you worked in ISRO with somebody, and
yes.
then a few years later, you're working with someone else. And how do you manage to keep that together? Like 5 years
I,
later, you call the same ISRO person. Will they be in the same sort of level of uh, uh, you know let's say a relationship, a friendship at that time as well, or how does
I
that
think
work?
the key is, as I said earlier, no, you identify people who are on the same page, who have the same objectives, and things automatically
Yeah,
work out. So in 5 years
yeah,
down the line, if they connect, we know that
yes, you
whatever
work
they're
together in
doing,
one project,
like,
and you're, yeah, highly accountable
and,
and dependable.
yeah.
Amazing. Amazing, sir. So, what is the legacy? I know you've written books, you've done so much for us already, but anything else that really would resonate with you at the moment? Is there something else that you want to leave behind as legacy?
I think for the youngsters in our country, I just want to repeat that India is a fantastic country, a huge opportunity. And as far as possible, youngsters should stay in India because there's the options are
Yeah.
limitless. I think at the same time, I think you need to have the right values, be dependable, deliver where you can. At the end of the day, and I think a very important aspect, especially to the youth, is treat your elders, your seniors with respect and dignity. I think that is
Hmm.
something that we have to educate our people. But on the whole, I think we are fortunate to be in the country that we are in, to call India home. And there's a great future. And I think with a healthy and productive youth, India, definitely I see India in a much, much better space in terms of the power and the impact that we're going to do for the rest of the world. Probably in the next decade, probably after a lifetime, but it's certainly going to happen.
So positive, sir. So optimistic. Thank you for those wonderful words and the reassurance that you've given us and our listeners today. So that was such a rich and inspiring conversation with Dr. Alexander Thomas. We heard about the milestones he has championed, from education reforms, accreditation standards, to protecting the welfare of healthcare workers. But perhaps even more meaningful were his reflections on leadership, resilience, dependability, what it truly means to live a life of service. And conversations like this remind us that progress in healthcare is not just about policies and systems, it's about the people who dedicate their lives to building them, often against the odds. Dr. Thomas's journey is a testament to that, and I hope it sparks reflection for all of us, whether it's healthcare or beyond, on how we can drive change with purpose and integrity. Thank you so much, sir. Thank you so much for spending your time with us. And thank you, listeners, for tuning into this episode of the Luminary Lounge. And I would like Dr. Alex Thomas to give a few sort of last remarks before we close this podcast for today.
Yeah, I think thank you, Aruna, for this opportunity. I think my message to all of you is, as I said, I work with lifestyle medicine. Be sure that you eat well, healthy food. Be sure that you sleep enough. It's very important, especially for us medical professionals. Be sure you exercise well. Be sure you connect with as many people as possible, and be sure that your mental health is good, that you have no stress.
Sure, sir. I will definitely connect with you offline on that. So thank you so much for spending a very, very precious hour with us, sir. And listeners, I'm Dr. Aruna Muralidhar. Until next time, may we all continue to learn from our luminaries and light up our own paths with wisdom and courage and passion. Thank you very much indeed.